It is my pleasure to warmly welcome a good friend and colleague and a giant in neurorehabilitation, neurologist by trade, to begin with Dr. Nirmal Surya, who is fondly known as Nirmal by colleagues. He is the current treasurer of Indian Academy of Neurology. He is the president-elect for Asia-Oceanian chapter of neurorehabilitation, and he is also the regional vice president for Southeast Asia region for World Federation Neurorehabilitation. World Federation of Neurorehabilitation is an integral part of Global Neurological Alliance, or GNA, which World Federation Neurology is proudly promoting to address brain health related issues. Very good afternoon to you, Nirmal. How are you?
Thank you, Tissa. Good afternoon. It is great pleasure to connect to you. You have been doing an excellent work for World Federation Neurology and also for the World Federation Neurorehab. And your challenge or to bring the World Brain Day together for past couple of years has been very inspiring.
Thank you, Nirmal. I know that you are a great advocate for better brain health in resource-limited parts of the world, not only for Asia, but whole world. How excited are you to see that WFN and MBS is joining hands to tackle the pandemic of Parkinson's disease head-on in 2020 World Brain Day?
I think it is, I'm very excited, and it is indeed very, very correct that Parkinson's disease being given importance, and that's what World Federation of Neurology has done, and they've joined with MDSI. So, you know, Parkinson's disease is something which is affecting nowadays everywhere, even younger people in this part of the world. And it's entirely a disease which can be treated with some facts, with some newer treatment, with some surgeries. So I think World Federation of Neurology taking World Brain Day for people suffering with Parkinson's disease is going to make a lot of difference in the life of many people across the world. And I think this is a great move, and I'm very happy. And like last year, where we have really taken headache and migraine to a global level, we would certainly like to take the awareness on Parkinson's disease to the global level.
Nirmal, thank you very much. And again, I wish you all the very best for your leadership and tremendous work that you are doing in India. These are not easy tasks. I just wanted to introduce you to our audience to get to know about your life a little bit more than what they know if they Google you. So they're going to learn a few things about you that they can't Google and find out having watched this today. Tell us about your childhood and what motivated you to pursue a career in medicine.
Tisha, you have asked a very difficult and personal question, but I tell you, if those people who were my school friends and childhood, they would never think that I would have ever become a doctor and will be in this position. I'm born of a very small town in Rajasthan, Jodhpur, in a low middle family who runs a small business. And you will be surprised that till I did my MD medicine, I used to sit at my shop, a small shop in the city of Jodhpur, which would make Rakhi and marriage things. And I was one of the person who could make all those things. So I was a handicraft person, and I have worked at my shop. I will go to the school, and from the school straight away go to the shop, and then come with my father to the home. So I never even thought, but my grandfather, both on maternal side and paternal side, had a stroke, and both died because of stroke. Possibly both had diabetes, and I could see that they had bad sores. I was very young at that time, and they probably died when I was 10 years or 15, between 10 and 15 years of age. So my father wished me when I passed my first year of BSc, he put me into the science, but I never thought that I should become a doctor. I always wanted to be a successful businessman. Then he told me that we would like you to become a doctor and serve the society. And that's where the whole thing changed. And after the first year, I did the pre-medical tests and I topped in first 100. I joined the MBBS, then I did MBBS, then I did very good to get the medicine, because those days you have to come in first 10 out of 90 to get the medicine. So that's how we did my MD. And my uncle used to live in Mumbai, so I used to travel often to the Mumbai. And I always felt that I would, after the MD, will come to Mumbai and become a cardiologist. So I came and met Dr. Goel. But at that time, Dr. Singhal, who was a leading neurologist in the country, he told me in Bombay Hospital, Nirmal, you got brilliant knowledge, why don't you join neurology? I said, sir, but neurology, there's no treatment. And this I'm talking about 84. So he said, no, the things are changing, Nirmal. And he insisted, and he changed my mind completely. The first case which I diagnosed was cavernous sinus thrombosis. And he was so impressed. The patient came with a little ulcer on the top of lip. And I said, sir, this is cavernous sinus thrombosis, and you start methicillin. So he was impressed and he insisted. And that's how I joined the neurology in 1985. And then I did DNB, I topped in the country. And from 1990, I've been practicing as a neurologist, and I'm now in the same hospital where I passed on. So that has been a journey from a businessman's son sitting on the shop and suddenly transforming himself to a doctor, then wanting to become a cardiologist, influenced by Dr. B.S. Singhal, who is the leading neurologist in the country, to become a neurologist is something amazing. Thank you very much for bringing this, teacher.
That's a beautiful story. I can relate to this story a little bit. I grew up in a small village also, and part of the deal when you grew up in a small place is studying is part-time. So you have to help your parents and uncles and aunts in their paddy field shops and other things, and then spend other time studying. And then once you enter into the medical school, rather accidentally, you have all the time to study. So it's very easy to top the class, or it's very easy to get good grades in medical school for those boys and girls. Presumably that's what happened to you. And then you did a miraculous thing, Nirmal, as far as I can read, you can correct me if I'm wrong. Before you embark on neurorehabilitation, sure, there were clever clinicians in India. The subcontinent always produced excellent clinicians with very high level clinical acumen. With that respect, not a lot happening in neurorehabilitation, and you decided to take this pretty much from the scratch. That would have been quite challenging. Tell us about that story and journey.
So, you know, the story is that when I joined Dr. Singhal, there was one Mr. Chabaria, who was the senior most physiotherapist in the country. And he was like my father figure to me. I was introduced to him through somebody. He was a par excellent rehab specialist. I've never seen such a beautiful concept. And I would have always discussed with him, even while I was resident with Dr. Singhal. And discussing with him and his team of physiotherapists, who are all neurophysiotherapists, I'm talking about 1985 to 89. My mind was already getting trained to the rehabilitation, and I was understanding and thinking that rehabilitation is a very important part of all neurological illnesses. And if we do not have a rehabilitation, we are going to get into trouble. And then when in 1990, I started my practice, I was sitting next to him in Bacha Hospital. So there was a rehab setup which we have developed, and I was with him. And then in 1996, we presented in first World Congress of Neuro Rehab organized by Professor Michael Bahn. I presented a paper of our cases of 5,000 cases which we treated over a period of 6 or 7 years at that World Congress. And then when talking to other people, learning, listening, Mike Bahn influenced, I pushed myself into the neuro rehab much further. And that's how it happened. And then in 2010, we did the first meeting on International Congress in Neurology and Rehabilitation in Goa, which was attended by more than 500 people with multidisciplinary, 4 parallel hall, 32 international speakers. I think that opened the floodgate for need of neuro rehab. When 200 people came and said, form a neuro rehab society, and they paid that time only membership fees, 100 of them. Take this 1,000 rupees, we want you to take neuro rehab leading in this country. And that's how we formed Indian Federation of Neuro Rehabilitation, which came into the effect from 2012. And now you know that we have done the World Congress 2018. So everybody knows about IF now. Thank you.
Absolutely. I think the World Congress that you chaired, which I had the good fortune of attending and doing a plenary and attending a workshop with our good friend Professor Raj Damja, that was one of the most memorable meetings. In fact, one of the things that we all are missing this due to this pandemic is traveling and meeting and intermingling with colleagues. But scientific community is making connections through internet, as two of us are doing now. Uh, my other question to you, Nirmal, is these days we hear from our youngsters the work-life balance issues, burnout, and the difficulties that they face. Part of the criticism that they take, say, is the heavy load of administration and so on. Knowing your life story, you run all these things, but you don't seem to suffer from any burnout at all. And I suspect a part of the deal is your passion. You are very passionate on bringing the best possible neurorehabilitation outcomes to not only for epilepsy, multiple sclerosis, Parkinson's disease, stroke, and the whole gamut of things. But that's my interpretation of how you have been performing. Let's hear it from the horse mouth. How do you balance work life? I know that you have a beautiful family, you have beautiful children, beautiful wife, and you have a reasonably balanced work-life approach. So what is your advice to a young generation in particular, and even for the old neurologists?
I think you have asked a question which is a lifestyle and how you manage your own life and how you balance between your practice, your work, your rest. So I would tell the people that why we are getting burnout. If you are forced to do something which you don't like, you always have no interest. I have always loved what I am doing. So if I'm practicing, I love to see the patient because that's a challenge I have to make a diagnosis. I take a challenge that, if neuro rehab is not developed or epilepsy is problem or this is a problem, I think and then I take a challenge. And once I take a challenge, I go right deep into it and will not leave unless it is being sorted out. And I want other people to also join. So as you rightly pointed out, passion. A lot of people tell me why you go to the rural area in a small district in the train where I've never traveled 20 years in the train to see the patient, and 1,000 patients come, 1,200 patients come. I say, this is a passion to help people out. I enjoy it. I don't feel that I'm going in a train and sleeping in a train which is uncomfortable, but I enjoy that. If I take it as a burden, I will feel pain. I'll not like it. I'll complain about 20 things. So that what I want to tell people is do what you like. Choose the subject, what you would like, and do what you like the best. Do not succumb under the pressure. If you don't like something, don't do it. So I will say, I will do, then do it 100%. If I don't do it, don't do it at all. So like that, we started the webinar. As you all know that lockdown period, I started the webinar and we did 30 webinar every day from 6th April onward till the 5th May. And the nearly 25,000 people attended the webinar. And we got certain good responses from them. So we started thinking that teaching is very important. And what I realized from the survey is people are hungry for the teaching. They are not getting good neuro rehab training anywhere in the world. There are very few centers, but they are not able to reach to them and they lack the training. You know, at the moment also by my side, there is a GATE workshop is going on. So we do every Friday, 4 to 6 p.m. the workshop. So now part 2 of GATE workshop, already they are going on. 90 people are attending. So this is a platform which we created to help the people. And so much people are excited to get into it. So I think, Tissa, we need to create a platform where education is one-on-one or being given to the people at no cost or low cost. And I'm sure neuro rehab people are hungry and it can be reached anywhere in the world. In fact, I have reached out to 40 countries and in India, each and every state, which I never thought that I would be able to reach.
I mean, I think you hit the nail on the head. You basically read my mind out. I 100% agree. I mean, right now, we both know that there are some political leaders, I wouldn't name them, who wanted to practice the old adage, divide and conquer. You and me both know diversity is a strength. Diversity is not a risk to this world. We both come from countries where multiple religions, multiple ethnicities live in harmony. Yes, there had been trouble, but for thousands of years, various fractions, various beliefs, people with various beliefs lived in harmony, and they contributed to exceptionally good philosophy. You take someone like Buddhist philosophy, Buddha coming from your country, they're still the unbelievably clever thinking. I think the acquiring knowledge is a basic human right, isn't it? Yes, this pandemic has pushed us to the back of the world. Despite some of those political leaders' belief, scientific community, which consists of people like you and me, we have no barriers. We both reached out to all countries across the board. In fact,
Absolutely.
this is my the seventh the World Brain Day that I'm involved in, and I have not reached this far in the past campaigns. But the lockdown and the travel being restricted has given me leverage to stay up late night and then reached out to sub-Saharan Africa, small countries in Asia, and then get their view. And you're absolutely right. This is what people are asking. When you look at the European Academy of Neurology virtual congress, I read somewhere that it was attended by 40,000 people because it is free. And I saw the Movement Disorder Society is launching their congress free in September. I would assume that all the internet gateways would be pretty much blocked, as there would be thousands of people, thousands and thousands wanting to gain knowledge. But at the end of the day, human suffering is universal. There's no Indian suffering or Australian suffering or Sri Lankan suffering or British suffering. It's basic universal suffering.
It's suffering.
Yeah. And the solution has to be universal also. We might deliver it in different ways, but although we might package it in a different way, the content has to be the same. And I totally agree. I think I'm delighted to see the scientific communities embracing this and offering what they know, learning from one another globally without having any barriers. Of course, both of us and others would work our very best to get this job done. And hopefully this pandemic would teach us. And you also touched upon the importance of low cost or no cost. We both know, having come from small places in the world, there are some places that $10 is a big thing, and that's like 1 week's salary. So therefore, offering some of these virtual contents free is a very useful thing to do. Nirmal, what are your hobbies other than when you are teaching and promoting these things? Tell us a bit about your family life, what you would like to share. So, how do you spare time other than medicine and neuro rehabilitation?
Absolutely. So my wife is a housewife, so I never wanted a doctor wife or working wife. So from very beginning, I was very clear. My daughter is now in New York. She did her chemical engineering from ICT, which is one of the best university in Asia. Then she did MBA from Sydenham College here. And then she was in Columbia University. She did a master's in financial engineering. And she, for a while, was worked in Adidas, and now she's working for Estee Lauder for making out all the programming and a lot of things. My son-in-law is a scientist. He did a PhD in nanotechnology from Columbia, and then now he worked for Intel for 7-8 years, and now he's working for a company in New York, Paul, which is making the membrane for all these, whatever we are using, the mask or in the airplane or in the technology. So both are well married, both are staying in New York, they are safe. From very beginning, I was very fond of music, and I always I never been a good singer, but listen to the music makes me very calm. And even while reading, throughout my study, MBBS, MD, my music will be very high. So a whole mohalla would be awake because of my music. It will be that loud, and I was peacefully reading. So that music.
Who are your famous singers those days?
And the classical singer Jagdish Singh was my most favorite, and his some of the results were outstanding. Then Kishore Kumar, Mukesh, Lata Mangeshkar, Asha Bhosle. These were some of the things which I used to love. Then I was a hard-die cricketer fan. So I used to play till my college days, but then the study demanded, so medical college, we reduced the playing. And then after second year, I did not play the cricket. But each and every cricket match anywhere in the world, whether in Australia, I will get up at 4:30 in the morning. In New Zealand, I'll get up at 3:30 in the morning. I would watch the matches. And I was a hard fan for cricket. So these are the two things which has always been still going on with my life.
Nirmal, it was absolute pleasure talking to you. You are a giant.
I wanted to add one more thing, that what I have realized in past 3 months is that tele-neuro-rehabilitation is going to be a very big thing in the future, whether it is Parkinson disease or whether it is stroke or whether it is any other neurological illness. We, particularly the lower income or middle income countries, need to look at the need of tele-neuro-rehabilitation. And I think this is going to be the future. The family-based rehabilitation and family joining with tele-rehabilitation is what we really should look at. And we should make a platform. I'm working on it. I would certainly would want you and World Federation Neuro Rehab to join hand to make a platform where we can provide a uniform neuro rehab services to the tele-rehabilitation.
I agree, and it is relevant to developed world also, Nirmal. We all know that, say for an example, a country like Australia, it's very hard for you to have all the providers concentrated right across the country. They would always concentrate on big cities and even in regional, reasonably major centers. I think the technology, just like they connected you and me today to discuss these things, that people would watch from all over the world later on. It's the power of technology. I think connecting dots and the delivering things as best as we can at their home is probably the best. When you and me get sick, we prefer to stay at home. That's where we are most comfortable. We both know that our very own hospitals are like jails when you become sick, isn't it? So yes. I think the telemedicine and neurorehabilitation is certainly the way forward right now due to the pandemic. And it is the way of the future. Let's hope that, like humans have done in the past pandemics, like Spanish flu and plague, they come good. Yes, we have seen worst of humanity and best of humanity both in recent times, but I am a firm believer. I'm an eternal optimistic, and I'm a firm believer that goodness will prevail. There are enough good people in this world.
Absolutely.
And we will see good days ahead. Stay well and all the very best. And you will join us, as you know, we are planning to do a 3-day virtual symposium around mid-August, and you are one of the invited speakers. The Raj is handling the Indian speakers component, and we will hear from you back again. Stay well, stay safe.
And I will connect you on the World Brain Day to India like last time. So we'll have a
definitely. Most definitely, yes.
So we will have you on our platform once again.
Take care and keep up the good work.
Thank you. Thank you, Tissa. Thank you and good night. Thanks for inviting me for this.